All right, so. Hey, what's going on, Ash?
What's up, man?
Hey, so, yeah, so I really tweaked my back yesterday, or like 2 days ago. I was doing deadlifts, and on my 4th rep, it was like a 200-pound deadlift. 4th rep, as I was picking up with my rounded back, I heard a really loud pop, and I had to drop the weight, and basically I've had a problem ever since then. I couldn't really walk well, and I had really like a lot of pain in my spine when I would round my back and bend my neck down. So it was like some nerve-related stuff, but I've known Ash for a really long time. He's the best chiropractor in LA, and so he's a good friend of mine too. And I came here for him to save me, essentially. So what do we do today?
So we did a lot of muscle work. We had to loosen up your QL. I think that was your main issue. Good thing is I don't think you had any disc problems, which would have been a lot harder to fix. Mainly we stretched it out, loosened it up like very safely. We do it in steps. We did stim to loosen you up. We did the stretching, and then we did the decompression roller, which decompresses your spine, stretches you out safely. What happens when you get an injury like that, I know you heard the pop, but your body spazzes out and goes into inflammation to protect you. So what we had to do is loosen it up and heal it properly, and you should be almost 100%.
So I actually have an L5-S1 disc protrusion. How many millimeters was it? Do you remember?
It was almost 4.
4 millimeter disc protrusion, and it's like lower spine. So I had a really bad back, and it was so bad that like I'd walk and I'd have shock in my back all the time, and this was an ongoing problem for a really long time for me. And then so I got this new trainer like a couple years ago. His name's Rocco. I post him all the time, and I told him, and I had to interview a bunch of trainers before I got him because I wanted to make sure that this guy had an education and he was like actually knew what he was doing. And I had Ash interview my trainers, and so Ash interviewed Rocco and basically told him what I needed to do. And so essentially he told Rocco that I needed to really build my back, so focus on posterior. So what did you tell him?
So you'll see most people, they work on their front, chest, only what they see. So I told them to really build the rhomboids and the back muscles to bring your shoulders back, down, and in. And once you do this, everything is in proper posture. Your core is more engaged. You actually get that curvature in your low back that protects your low back. You need a little curvature in your lumbar spine, your low back spine, because that's what gives it the support it needs. So once you built this, that curvature came back, and now you have the support, so you're not getting constant pressure there. And then it also helped with your shoulders, which that was one of the issues we were having too. So that once we got that strong, takes care of everything. So
I had really bad shoulders too. I thought there was a rotator cuff issue. We did MRIs with dyes in both my shoulders, and it was so bad that I couldn't lift anything, and it was all as a result of bad form. So they fixed my form. We use my lats now to push for any bench related exercise. I actually use my lats for everything. It corrected my shoulders. I built up my shoulders and my upper back, made a big difference, and also my lower back pain went away because Ash told my trainer to really focus on my glutes, build up my glutes. So we do a lot of really intense glute work, and it's almost like these girls are like building their booty and stuff. Well, that's me essentially. So Ash basically directed my trainer to to really focus on glutes. So I got really strong glutes, eliminated lower back pain, really great shoulders now because they've been built up and no more shoulder issues there. And then mid back, I had problems there too. And now this new issue, which we don't really know what it is yet, if it persists, I feel a lot better now after what Ash did to me today. But if it persists, we'll do an MRI and see what it is. But all of this is correctable through the right muscle work. So, and I didn't believe that. Actually, I thought Ash was crazy when he was telling me this stuff. But it works, and I'm so much better now.
Thanks, brother.
Thanks, brother.